Hi, and welcome to Attentive Healthcare Solutions webinar. My name is Chelsea Grover, and I'm the Marketing Communications Coordinator for Attentive. Before we dive into today's webinar, I want to take a moment to explain the process for today's presentation. First, I want to mention that this webinar will be recorded. Next, I wanted to mention for those of you who are familiar with how we normally do our Attentive webinars, that this one's a bit different than what we traditionally have been offering, except with the last week, you might have noticed that we've been doing these mini webinar series on COVID-19. The goal of that is to really just provide these topics that pertain exclusively to COVID-19 in hopes that we can help you practice, find something meaningful in them to help you be able to better serve your patients during the current crisis. Okay, so I wanted to mention some upcoming webinars that we're going to be continuing on the COVID-19 mini-series. On April 6th, which is Monday, we're going to be covering keeping your patients informed during the COVID-19 crisis with NextGen messaging solutions. So if you haven't registered for that one and you're interested, you can head to the events and education page on our website and register directly there for it. Back to today's presentation on using NextGen Mobile during the COVID-19 crisis. At the end of the presentation, we'll open the floor up to questions from you, but we'll answer all the questions at the end. You can type the questions in the questions area of the webinar control panel whenever they occur to you. And everyone's phone will remain muted throughout the entire webinar. So if you experience audio issues, use the chat box to let us know. So without further delay, I'd like to introduce our presenters for today. Lexi DeMarche is Manager of Consultant Development at Attentive, and Cindy Kincaid is Vice President of Consulting Solutions. And we also do have Adam Boron on, who will be able to help with questions at the end. So Lexi, the webinar is all yours. Feel free to get started when you're ready.
Okay, thank you, Chelsea. So thank you everyone for taking time out of, I know your schedules are pretty hectic. So today's brief webinar, we're going to go over some of the many NextGen mobile features that may be beneficial to your practice, not only just during this COVID-19 crisis, but even beyond. So for those of you that aren't, maybe as familiar, NextGen Mobile is an application that's going to allow clinical staff to access key parts of the NextGen software, and they can do this really anywhere that they have access to a mobile device. So mobile is compatible with many Apple, Windows, Dell, and even Android devices. And it's an app that is downloaded in the mobile app store, so for whatever device that you have. There are two subscription tiers, so mobile and mobile plus. So I'm going to be focusing primarily on the complimentary mobile version in today's webinar. But if there are any features that I mentioned that require mobile plus, I'll make sure to point those out. So navigating the mobile application is made pretty simple. So at the bottom of the application window on most screens, there is a menu bar. The first view is known as the hub. So this hub is going to be the main landing page, and that's going to allow users to access things like the jobs list, and that is used for dictation services that does require mobile plus. They can access the PA queue or the provider approval queue, medication tasks, and charges. Charges is another feature that does require mobile plus. The next view in our menu is schedule. The schedule view is going to display the daily schedule for any selected resources. Our third view is messages. Messages is going to allow a mobile user to send secure messages to other NextGen mobile users. And then that final view in our menu is settings. And that's going to give the user the opportunity to customize some features in the NextGen mobile app. So now we're just going to dive deeper into each of these views and just kind of see how they can make your providers more productive and stay connected. So a key part to a provider's ability to serve their patients while they aren't physically in the practice, so such as a lot of you are experiencing right now during this COVID-19 crisis, really is the ability to access a patient's chart. So this can be accomplished in NextGen Mobile through what's called the patient details. So patient details, you can kind of think of it like a mini chart. It's going to include some patient information such as the patient's picture, demographics, and some clinical data. So this patient detail screen is accessible from a few places. So we can get to this from the hub. We can access this from schedules and also within messages. The data that we see here is pulled real time from the EHR. And just to keep in mind, for the most part, it's not editable. So that's just to ensure that the latest, most accurate information is being shown. So both here in the mobile app and then also in the EHR as well. On this screen, a user will also be able to see patient alerts that were configured in the EHR. And if an alert was set to pop up for acknowledgement in the EHR, it will pop up in the app as well. So this really is just vital to ensure that those important alerts, such as maybe a patient's pregnant or they're potentially drug seeking, they're seen here in the mobile app before any clinical decisions are made. At the bottom of our patient details window, there are 4 icons that will give some additional functionality. So the first icon is a microphone, and that will allow for dictation in the patient's chart, and that is with the Mobile Plus version. The second icon is a camera, and that's going to allow a user to capture or even select photos, and those can be used in secure messaging or sent to the EHR. The third icon is going to allow a user to start a new secure message regarding the current patient that's open. The final icon will allow a user to attach and edit a diagnosis codes, and that is through IMO. And that feature does require the Mobile Plus version. The clinical information can be expanded by clicking the plus sign. So
Hey,
the
Lexi, could you
first
repeat that?
category.
We lost your audio for a second there.
Oh, I'm sorry. Did I lose audio? Can you hear me?
Yep, I can
Okay.
hear you. Could you just repeat that section?
Yep, so I'll just open it up. So I was just saying that the clinical information and the patient details is divided into 2 tabs. So that first tab is the face sheet. This face sheet is going to group patient data into several categories. Those categories can be expanded by clicking the plus sign. So the first category is demographics. So this is going to share some patient demographic information, so things like the patient's address, their phone number, if there's a referring physician or a primary care physician that's on file for the patient. Our second category is medications. This is going to show all active medications and also allow for new medications to be e-prescribed. There are also categories that will show things like allergies, allow entering charges with Mobile Plus, view problems, past medical surgical history, the last HPI, lab results, and then also vital signs. The second tab on this patient details view is going to show documents and images in the patient's chart. So if a practice is using the dictation feature, this will also include dictation documents. If both type of documents exist for a patient, you'll be able to distinguish those by either an orange EHR icon for EHR documents or a blue chat bubble for dictated documents. And in addition, if any of these documents are associated with sensitive encounters, they're going to be marked as sensitive in this view. Documents can be shared with other users, and that's using the secure messaging feature. And documents and images in this view can also be searched, and you do that by swiping down on the patient details header. So in addition to viewing patients' clinical information, providers can also manage medications and e-prescribe from within the application. So we know that a lot of your practices are having to cancel your non-emergent appointments. So you may be inundated with requests for medication refills or new prescriptions until it can be seen again in your office. So providers can handle these requests within the mobile app. So from the patient details view, the user would expand the medications panel, as we can see here. By default, only active medications are going to display in the list. So if a user does want to see inactive medications as well, they would toggle that filter off. From this window, a provider can click Renew, and that's going to quickly renew the medication. And just like in the EHR, they can make any modifications they need to before sending the prescription. Clicking View Edit is going to show additional medication details and that's going to allow for any changes to be made as well. So to prescribe a new medication in the app, the provider would click the new medication link. And much like in the EHR, the medication needed can be found in a few ways. So they can search using the search medications field, or they can also use their medication favorites list, and this comes from the EHR. Tapping on the encounter listed next to the patient picture is going to allow the user to select a different encounter to associate that medication to if needed. So it's important to note that if no unlocked encounters are available for this patient, that a new billable encounter will be created by prescribing a medication in the app. Next, the patient's default pharmacy will be available for selection. If one doesn't exist or the patient wants the medication to go to a different pharmacy, a pharmacy search option is available. Once those medications are entered, they can be e-prescribed from the app as well. So in addition to prescribing new medications, providers may also need to manage medication refill requests. They might need to do that, without being able to access NextGen outside of the office. So the hub within the application has a medication task category, and that's going to display a list of all refill tasks. These tasks are going to be ordered from oldest to newest by default, but the provider can reverse that order if needed. So the provider can come in here and they can select a refill from the list. They would review all the details of the request. Once that request has been reviewed, the provider can select approve to accept the refill, or if the request is not approved, the provider can select deny, and they'll be prompted to enter a denial reason. Another important aspect of keeping your practice productive when providers are not in the office, so during this COVID-19 crisis or even after, is to ensure that the provider approval queues are frequently checked, and also managed. So from the hub in the mobile app, a provider can quickly see pending items in their PAQ that need their attention. So they're going to see all pending documents, images, order results. It is important to note, however, that at the current time, NextGen Mobile does not support the sign-off of scanned documents from the app. So from this PAQ view, a provider can filter by item type, and they can choose how their items are sorted in the list. So for a provider to review a pending PAQ item, they would click on that item in their list. This is going to allow them to review the document or their order result just like they would in the EHR. If any PAQ comments need to be added, tapping the note icon in the top right will allow them to add those sign-off comments, and they can even view previously added comments if there are any for the item. At the bottom of the screen, there will be 3 buttons for the different PAQ actions. So if a provider has any PAQ rules configured in the EHR, so let's say, for example, they want a task sent whenever they're signing off on order results, those rules are going to take place in the app just like they would in the EHR. If a provider needs to reject a document or image, after clicking reject, they will be prompted to enter a rejection reason. Providers will also have the option to reassign PAQ items. So if something ended up in their queue in error, when they click reassign, they will be given a list of PAQ resources to choose from, just like they would see in the EHR. So keeping on top of providers' daily schedule, so whether on a normal day they're running back and forth, let's say from the hospital, or as of now they might be at home conducting virtual visits. So that can be challenging for some providers to manage those schedules. So using the schedule view in the NextGen mobile app, it's going to make it simple for a provider to not only see what upcoming appointments they have, they also have the ability to see when those appointments have been checked in. The schedule in the app is real time, so it's going to continuously update. So, as any changes are made to the schedule in PM. For each appointment, user can quickly see the patient name, the MRN, the appointment time, appointment reason, the location of the appointment, and then also a check-in indicator, which is that green circle. So if a user would like to see multiple schedules at one time, they can click on the resource link at the top of the screen. If they do select multiple resources, those patient appointments will be color-coded, and that's just going to help the user identify which schedule each appointment belongs to. Swiping left on an appointment is going to reveal a More Details button. This is going to allow the user to see information like the appointment description, duration, and whether or not the appointment was confirmed. Mobile users also have the ability to incorporate phone calendars into the patient schedule. So this can be, for example, like a personal iPhone calendar, or even maybe a calendar of US holidays. Any phone events will display with a gray bar on the schedule, and that's just going to allow the provider to easily distinguish those. And if a practice is using Auto Health for their virtual visits, within the app, a user can easily see that a patient has been checked in for the visit by a green camera icon. So the provider can see that the patient has been checked in, and then they can actually start that telehealth visit by clicking on the camera. So if the providers at your practice, maybe on a normal day are spread out among several locations, or even now seeing those patients virtually from home, it can be difficult, to keep that open communication, but while making sure that it's secure. So, as you're aware, sharing patient data, over texting or email, that can open your practice up to some additional liability. So a great feature in the NextGen Mobile app that addresses that concern is secure messaging. So with secure messaging, your clinical staff can not only communicate with other mobile users in your organization, they can also even send invites to the conversation to users that don't have the mobile app. So if a user does receive an invite to participate in a mobile secure message, they will be prompted to download the mobile app before they can begin. This would give them access to a limited version of the app, so they're not getting full access to the app or your practice. And the NextGen Mobile user that invited them will actually be able to select what they can share with them. So to begin from the messages icon in the menu bar, a user can navigate to this screen and they can not only start new conversations, but they can also manage their existing ones. Within a secure message, in addition to normal text messages, users will also have the ability to send audio clips, photos, and even documents. So at any point in the conversation, a mobile user can choose to send a transcript of the conversation to the EHR. And this will generate a document that's going to live in the patient's chart, so they can go back and review that at any time. All texts and photos that were sent during the conversation will be included in the document. It is important to note, however, that audio messages are not included in the transcription, but they would remain in the app, so a user could go back and review those at any time. So sending a secure message within the app, it's pretty simple. As simple as just sending a text message from your phone. So from the messages view, the user would select the paper and pencil icon to start a new message. They would then be prompted to select one or more contacts to add to the conversation. Next, they have the ability to add a patient, and that will select them to be the subject of the message. If a patient isn't selected for a particular message, a group name can be added, and that's just going to allow the user to differentiate that message in their list of messages. As I mentioned on the previous slide, in addition to typing out text messages, a user can also click and hold the microphone icon, and that's going to allow them to record and send an audio clip. To send maybe photos or documents, or even a patient face sheet externally, so to an outside user that you invited into the conversation, the user can click the share button, and that is that icon with the arrow and the pieces of paper to the left of the text field. Something to note about photos that are captured through the mobile app is they are not actually stored on the actual device that is taking them. You also don't have the ability to add photos from your photo library to a message. So because of these restrictions, these images are considered to be HIPAA compliant by NextGen. So finally, I just wanted to review the NextGen Mobile Cloud Portal. So this is a website that's going to allow your practice to you can create and manage mobile NextGen users. You also will have the ability to run several reports, and that's just going to kind of show your clinical staff's mobile app usage. The Cloud Portal also allows you to create groups to assign app functionality permissions, and that's going to work similarly to System Admin. And if your practice has Mobile Plus and uses the application for dictation, you can also use this website to monitor and troubleshoot any dictation issues. So I know that all of your practice are having to find new ways to be productive and continue to serve your patients throughout this COVID-19 crisis. So hopefully you've learned some new options within the NextGen mobile application, that can benefit your clinical staff by making it easier to stay connected and also allow them to do what they do best, which is treat their patients. So before I send it over to Chelsea for questions, I'm going to turn it over to Cindy Kincaid, and she's going to give you some insight to what some of our clients are doing.
All right, thank you, Lexi. All right, this particular tool, NextGen had made available what we were calling the complimentary version or the basic version, and many of our clients had actually seized upon that. We did have a few that had went to the enhanced version as well, and be able to do things like send charges back, etc. The one group in particular, which is in Westchester County in New York, which for those of you who are not familiar with that, is part of the New Rochelle, which was the initial, I would say, heart of the outbreak in New York. It's obviously not the city, and that's taken over. They actually had been in the process of implementing this, and when that happened, many of their providers are on the front lines. They're operating COVID testing facilities. They're working from home, and they have become very much in using this and looking at their PAQ and using it in conjunction with their telehealth operations and things that they never imagined at the time when they purchased this, that it would have any value at this. And that's one of the reasons we just wanted to mention this for those of you who do have it. Think outside the box on how it can be used, because it's really been a very, very effective tool for them. And I just wanted to, just mention that it is something that we feel is valuable as it relates to this. If you do not or have not signed up for the complimentary version, it is somewhat of an implementation challenge. Not hard, but it does take time. So it would be something you would want to reach out to your NextGen account reps or someone in that capacity if you wanted to do it, and then determine which version is best for you. But really, we just wanted to open it up for questions and present this tool and let those of you see how you might be using it.
Great, thank you, Cindy, and thank you, Lexi. We're going to answer all the questions that we've received. We should be able to go through them all, so if you have them, feel free to type them in, and we're just going to start from the beginning and go through them. Again, they can be typed in the questions area of the webinar control panel. So let's get started. For medications, can providers e-prescribe narcotics? Adam?
Yep. Currently, at this time, controlled substances are not able to send from the mobile application.
And Adam, there was a follow-up question to that. Do we know when that might be available?
At this time, there's not been a timeline released of when that functionality will be available.
Yes, I actually spoke to NextGen about that, because obviously that's something that all providers are interested in, and fundamentally there are some dual authentication requirements that they're not sure mobile would be able to incorporate into its workflow easily. So that's the reason it's up in the air, and there is no time frame for it.
Thanks, Cindy. Can the provider task their nurses after adding a note in the PAQ?
Currently, tasking is on the radar to be added in as added functionality into the mobile application, but at this time, tasking is not built in.
Thanks, Adam. Is there a way to send, or I'm sorry, is there a way that the patient can send a picture to NextGen Mobile?
Adam, I know you were IMing me. I would answer that as we had. I think we have to just,
Okay. Yeah, so with NextGen Mobile, to be able to use the secure texting, either you can send it to people that are registered within your organization to mobile, or it can see your phone's native contacts so that you would have to have the patient saved as a contact on your phone in order to message them. I would not recommend using this, using mobile for patient communication rather than just keeping it within your organization or other healthcare providers.
Great, thank you, Adam. Somebody was asking if the slides will be sent out. Yep, I will be sending out a copy of the recording and slides to everyone who registered for the webinar. Hoping to do that this afternoon, but if not this afternoon, then Monday at the latest. We'll send those out to you. We are vascular surgeons. We love uploading pictures to patient charts. Cindy?
That's really, I think that corresponds just with just a comment. It's one of the positive things about this, and I'm glad that you're enjoying that functionality. That's again taking a photograph of the patient when you're in the office, so that's more of an in-office use. To kind of piggyback onto Adam's question earlier from Carol, that it's not a patient sending it to you, but it is really a wonderful functionality of being able to do that.
Okay. Well, it looks like that might be all the questions we have. Cindy, do you have anything to add before we close this down?
No, I think the same way that we've been closing all of these. You all are on the front lines of this. We are here to do everything we can to help you. We just appreciate everything you're doing for your patients, and as we work through this crisis and know it's hard, it's such a hard and unprecedented time in the country right now and in the world. And we just want to thank you for all your efforts and wish you the best and stay safe and healthy.
Okay, thank you, everybody. Thank you for joining us today. Hope that we see you in on the next one on Monday. And again, you can register for that directly on the events and education page of our website. Thank you so much for joining us.
Bye, everyone.